Hi, my name is Dr. Izquierdo. I am a geriatrician specializing in aging, and today we're going to talk about what is normal versus what is considered dementia. Can you tell the difference? Now, knowing the difference empowers families to seek help at the right moment, not when we're in crisis, not when it's too late or where we can't do meaningful interventions. You see, families often confuse normal aging with dementia, and this can cause a lot of fear, frustration, and delays in care. Oh, he's just getting old, there's nothing to worry about. Or, oh, that happens to everybody, there's nothing to do there. Well, this is wrong, and I want to help you clarify what's normal and what's not. So these are examples of normal aging, and we can have them at any decade, and it can also be influenced by stressors, anxiety, depression, grief, or significant life changes such as losing a job, moving around, being in episodes of high levels of stress. Okay, so what is considered normal aging or normal changes? We can misplace keys but find them later on. We can forget names but remember them eventually, even at night or the next day. We can walk into a room and forget why we were there or what we were looking for or what we were doing. And it's going to take longer to plan or multitask. Again, as I mentioned in the previous classes, aging causes slower brain processing. So again, we're going to have major difficulties planning complex steps or planning big parties or doing complex recipes because it's going to take a longer time to just process and go through everything in the correct order. So, is dementia part of aging? The answer is no. Although, as we age, our risk for developing dementia is going to increase by in each decade significantly. It's not part of normal aging. Dementia is a medical condition. It's known as a syndrome that can impair multiple parts of the brain. Now, these areas are called neurocognitive domains, and they include different things such as vocabulary and language, our memory, our problem solving abilities, reasoning and judgment, as well as areas known as executive functioning. Now, depending on the type of dementia, we can get impairment in one of these areas or multiple areas in different orders or sequences. Alzheimer's is usually known for having disruption in language and vocabulary first, so we may see that patients have word finding difficulties. They can't name common household objects. They start pointing at things because they can't remember their name, and this can be a sign of early vocabulary loss. Now, it is important that if we do have dementia, we're going to have impairment in daily functioning. We can have something that's called mild cognitive impairment, where we start seeing some of these areas having impairment, but if they do not interfere with our independence, then it's okay. We can still compensate, we can still intervene. So, what is impairment in daily functioning is when we can't do self care, toileting, hygiene by ourselves. Now, how can we detect this? The first thing that I see in the office is that the patient starts to smell of urine. Now, we can have incontinence or we can have other issues that we need to explore, but they're going to have issues with the sequence of events happening within their hygiene routine. They can forget to wash their teeth, they can forget to, wash different body parts. And again, we have to figure out if it's not due to a physical impairment, visual impairment that really is impeding this, but we must always evaluate for cognitive impairment as well. So this is very important, and that's how we can tell apart dementia from normal aging. So, what are other early signs of dementia? Now, this is something we see commonly. We sit down with our grandparents or someone we love, and they're repeating the same question or the same story over and over in a short period of time. I'm talking about an hour. Now, this is a red flag. This is not normal aging. This showcases that they already have an impairment in recall and registration, so they can't register that they already had that conversation with you. So this is a red flag for us. Uh, Also, getting lost in familiar places. So if we went to the same supermarket for 30 years and now I can remember how to get to the supermarket, again, I am having impairment in memory. So this is another sign that we might be developing dementia. Difficulty managing bills or medication is also a warning. We we have activities that are called instrumental activities of daily living, and these include managing bills, managing the telephone, managing medications, doing housework, among other things. So if we see that they have a new impairment in any of these areas, it can be a sign that something is going on. So with medication management, this is usually one where there's a huge safety issue. I've seen patients over and over having low blood pressure or low blood sugar because they took the same medication twice or three times in the same day, and this can be a high risk issue. So we need to get involved with medication management as soon as possible. Pill boxes help, but sometimes we need a caregiver who's devoted to this and who works with their medical provider to intervene. Now, we might also see personality or behavior changes, and I'm talking about 180 changes. Someone that was very religious and went to church on a weekly basis and now doesn't want to go. Now, this is something that's wrong. Again, we can have physical issues, we can have depression, we can have other things that are impacting this decision, but some subtle changes can really help us put together the proper diagnosis. And we can also see them forgetting recent events entirely. And I'm talking about they went to a wedding last weekend, and when you ask about the wedding, they don't know. They can't recall that they were there. So let's recap the core difference between normal aging and dementia. When we age, we're going to have slower information processing, and again, this can mean tapping into our memory and recalling certain information, but it's not impossible. It's just a slower process. We can have occasional lapses where we might have trouble retrieving information, but we can still do it. Hinting helps. We can give a clue and they can fill out the information, but it's not lost completely. And again, these types of changes are not going to be significant and are not going to affect our level of independence. And a very important hallmark, we shouldn't have a significant personality change. Now, as we age, we have a lot of biological processes that are evolving. So, for example, sleep might be affected. We might have stressors or any type of mood disorder that can really affect our personality, but it's not itself a problem related to aging. It is a sign that something else is going on. Dementia is not the only thing that can really affect our personality or our behavior. With dementia, remember the information is lost completely. There's no way to retrieve it once we have a significant impairment. And we're going to be having progressive problems as time goes on because, as I mentioned earlier, dementia is related to cognitive decline in different areas of the brain. Now we can have again memory and language be affected first, but then we can jump to decision making, to judgment, to different areas that we're going to start seeing changes and impairments leading to more daily life disruption and or loss of independence, which really is a problem. The bottom line is that normal aging is about speed changes. Everything is slower. It takes a longer time. When we have dementia, is about loss of information, loss of mental capacity, loss of independence that is going to disrupt our daily lives. So when should we ask for help for medical evaluation? Number one, again, if we're having issues with memory, language, or daily functioning, This is always something that warrants additional evaluation. And again, think about the hygiene next time you see your loved one. Do they smell well? Do they look disheveled? Do they have the appropriate attire on? Are they having issues with their buttons? Are they running out of their medications before it's time for a refill? Do they have groceries? Again, this could be subtle changes that can really help us identify that there are other issues going on. Safety concerns are always the main driver. If we see that they cut themselves because they can't handle the knife anymore, or because they can't use the blender, they forget how to use the microwave or the toaster, they start missing meals. Again, these are signs that we are unable to deal with our daily needs, and this should always warrant, additional support, supervision, and evaluation and intervention. If we see abrupt decline in physical or cognitive abilities, and this can be again changes in behavior, changes in the way they communicate or they take care of themselves, this is also warrants additional evaluation. And if we see that something is off, um, when we're taking care of a loved one, we are the experts of their personality and their behavior. And if we see that they're suddenly drifting away from what they're usually is their baseline in terms of attitude, behavior, normal eating or sleeping patterns, then again, this could be a sign that something else is going on. So, as caregivers, what can we do to support healthy aging and support someone who is losing some cognitive abilities? Number one is keep routines simple and predictable. So this means having a schedule. I'm gonna be there about 5 every day. I'm gonna do my best to help you with the medications, or I'm gonna bring the groceries every Friday on the dot at this time. So having a predictable routine, it can really help them feel supported and calm, and really that they are not alone within all of these changes. Our environment is very important. Now, having a cluttered environment can really predispose someone to falls and greater confusion. So it's important to have the areas as clean as possible so they can have everyday objects accessible and visually present, so it's easier to do their day-to-day chores. So less is more in every way as we age. Now, noise is something that is very important to control, especially when we're trying to have a conversation with our loved ones. If the TV's on and the radio is on and we're trying to compete with all of that noise on top of that, again, the brain is going to have a lot of trouble processing all of the environmental noise and filtering out what's important and what's the message. So something that we can do is turn everything off and just sit at eye level and talk slowly to them. And this is very important because after 65, 1/3 of us are going to have hearing and visual difficulties. And again, we have to have a clear, noise-free, simple environment to really support our capacity. And we need to, number 4, approach with patience. Now, we get angry when we hear the same story over and over again, and we confront and we correct, and this is gonna get us frustrated and them as well. So I know it's hard, but try to be patient and just aim to redirect and clarify, and always try to keep your voice down in a subtle calming voice. Now, patients with dementia have something that is gonna mimic the way that you're talking and being. So if you have a very calm and serene demeanor, they're gonna remain calm. If you get angry, they're gonna get angry. So you have to be peaceful with them. And 5, seek support early. I hope you learn from this video what are the red flags for seeking medical attention and doing it early before it's too late. Last but not least, you're not alone. Awareness is the first step towards better care and better outcomes. And just understanding the difference is the first step. I invite you to subscribe to my channel for more calm and clear dementia education. And I'll show you more information regarding things I wish families knew sooner.